Hello, I am Dr. Vijay Deshmukh, founder of Smilex, practicing implants for last 30 years. This question is asked by one of the patient and he asked, I had undergone angioplasty recently, can I have dental implants? So today at Smilex, we do treat arena of patients from different age groups. So definitely our larger age group is 50 to 70 and we do have patient from 70 up to 85, 90. So today almost 1/10 or every 10th patient comes to Smilex. We see that the patient is on blood diluting medicines. Also we see that there are some undergone some cardiac element, they are undergone angioplasty or some patient has undergone bypass. So today we don't have the criteria that the patient has undergone angioplasty, we cannot do implants. Today we have very open-mindedness. So we keep a buffer of 6 months after the angioplasty or the bypass surgery or any heart surgery patient has undergone, and after that we consider the patient to go for a dental implant. So 6 months of buffer time is important to give the patient a complete rehabilitation time for the cardiac health. Then we ask the fitness from the cardiologist that the patient is considering to replace the teeth by dental implants. What is the right time? And most of the time the cardiologist give us the fitness. They give us the instruction when to stop the blood diluting medicines, and under their guidance we definitely plan the dental implants. So it is a teamwork between the implant surgeon and the cardiologist or cardiac physician. We treat these patients. Sometimes if the patient has really complexities, we do operate such patients in the hospital setup also. But most of the patients we can do under local anesthesia at the clinic at the center. Local anesthesia for these patients is always safer. We try to minimize the dose of the local anesthesia. Also, we want to minimize the period, the duration of the procedure. So most of these patients, the appointment has to be 30, 35, 40 minutes. We don't stretch it, we don't make it very long, tedious procedure for the patient. It has to be shorter, many visits to the patient. If the patient is going for full mouth rehabilitation, then we divide smaller appointment. It becomes safer for the patient. It is becoming less taxing for the patient. So due care with the patient, the due care with the patient's physician, and all the instructions, we plan the case, and then we can comfortably do dental implants if the patient has undergone angioplasty or patient has undergone bypass surgery. So it is a routine practice with proper care, with a shorter visit, selecting the top brand so that we need not to repeat the procedure in the future, selecting a safer anesthesia, selecting a nice protocol, keeping the appointment in the morning when the patient is much fresh. We can do dental implant for such patients. So today, patient has undergone angioplasty, we can still plan the dental implants after the buffer time is over. After the time of 6 months is over, we can comfortably do the dental implants. So thank you for watching Smilex. If you like, please like and subscribe to us.